Welcome to the Workamper Show, a podcast devoted to helping you discover how to finance your RV travel dreams. I'm Steve Anderson, the president of Workamper News. Each one of our episodes will either introduce you to people who are already living the RV lifestyle or to opportunities to work short-term jobs. You'll also learn how to hit the road the right way and make the most of every opportunity. Now let's turn over today's show to your host, Greg Gerber.
Thank you, Steve. Today I will be speaking with an entrepreneur who has been working with a major healthcare provider to create a plan specifically for full-time RVers that makes it easier and more affordable to access healthcare on the road. Today's episode is sponsored by The Dreamer's Journey. It is an online course and community produced by Workamper News. Life is way too short to keep your dreams on hold, so don't be held back by fear because you were designed for more. Get started in the RV lifestyle the right way with this comprehensive guide. For just $29.95 for 1 year of access, Dreamers have unlimited viewing of 50-plus videos to learn things like what type of RV to buy, goal setting, how to budget for the adventure, developing a positive mindset, setting up a domicile, and operating a small business on the road, plus everything about work camping and how to find the right job for you. Each video is 30 to 90 minutes long to give in-depth coverage on every topic. There's no wrong time to get started, so for more information, visit www.rvdreamersjourney.com. One of the most frequent objections I hear for jumping into the RV lifestyle is, what about healthcare? People who get health insurance through their jobs are often shackled by extraordinarily high costs for out-of-network visits to doctors and hospitals. Since the point of RVing is to travel out of your area, many people are fearful they'll pay through the nose if they ever need to see a doctor. Kyle Henson understands that concern very well. Not only is he a full-time RVer, but he is the founder of Nomad Insurance. It is a company born out of the need for somebody who understands the RV lifestyle and the big gap of options for healthcare available to nomads. However, Healthy Nomads is not insurance. It is a membership-based healthcare program specifically created for RVers and other frequent travelers. It offers significant savings to traditional health insurance plans. There are three main components to Healthy Nomads. The first is medical cost sharing, where members submit bills for major medical expenses from an illness or injury, and the cost is paid from a trust fund created by the combined monthly dues of all members. There is an initial amount that members are required to pay first, but then the program kicks in and generally pays 100% of the remaining amount. It is designed specifically to take care of medium to catastrophic medical needs. The second component is virtual primary care, in that members have access to a primary care doctor who is familiar with their health history. Patients work with the same physician wherever they may be by connecting through an app for face-to-face consultations. Members can also virtually consult with urgent care doctors on matters that cannot wait a day or two for a patient to consult with their regular doctor. The third component is an essential savings package that gives members 12 different types of discounts on a variety of medical services. That would include things like dental care, vision and hearing, alternative medicine, prescription drugs, lab testing, MRIs, counseling services, and others. To tell us more about how Healthy Nomads works for full-time or frequent travelers and, more importantly, what the program costs, please welcome Kyle Henson, the founder of Healthy Nomads, to the show. Thanks for joining me today, Kyle. I really appreciate it. It's always nice to talk to you again. And I understand you've developed a brand new program that RVers are going to be interested in called Healthy Nomads. Why don't you tell us what that is and why you started it?
Thank you, Greg. It's good to talk to you again. It's been a couple of years since we talked about the Nomad insurance that I had launched a few years ago. Healthy Nomads was born out of Nomad Insurance, and Nomad Insurance was born out of a need in the RV community for somebody who understands the lifestyle of RVing and the big gap options for healthcare that we can actually use as nomads. So I launched Healthy Nomads after many years of people asking, okay, can we come up with our own product for the nomadic community? And for many years I wanted to, but the legislation in place would not allow you to do it. particularly the Obamacare. They wanted everybody on Obamacare, so they made it very difficult to come up with any alternatives unless it was an employer-sponsored plan. So anyway, Healthy Nomads, I have launched it separate from Nomad Insurance because I need to differentiate it from insurance products because it's not an insurance product. It is a membership-based healthcare program that we've created specifically for RVers and other frequent travelers with the aim of providing better access to healthcare and benefits that we can actually use given the lifestyle that we live, and to do it with significant cost savings over traditional health insurance plans. So there's a few components to Healthy Nomads that make up the plan, but we can dive into that a little bit later.
No, why don't you go ahead with that right now?
Okay. Healthy Nomads has three main components. The primary component is the medical cost sharing. Medical cost sharing is designed to help pay for a significant medical need. And significant medical need can be anything from an illness to an injury. You would have what's called an initial unshareable amount that the member is responsible to pay for first. And then the program kicks in to pay generally 100% above the IUA amount. So the medical cost sharing component is designed to take care of the medium to catastrophic medical needs. So that's component one. Component two is virtual primary care. So this is something we built into Healthy Nomads because I believe that having a primary care doctor, somebody who knows your health history and can help manage any chronic illnesses if they exist, is important. And it can help reduce the chances of a more significant claim other than an injury, of course. So we've built in virtual primary care with a company called HealthTap. So virtual primary care gives you a primary care physician that you can work with virtually from anywhere in the country. So you can do consultations. You can generally get an appointment within a day or two for your primary care physician, and that doctor can help from a need you have in the moment, such as maybe an ear infection or influenza, and you just need a prescription. Or they can help with your annual routine care as well. That is the second component. You can also work with urgent care doctors through the virtual primary care benefit. So let's say you have a more urgent need and you can't wait a day or two to speak to your primary doctor. You can just get an appointment within minutes to whatever doctor is on call. A lot of people are used to that. They've worked with telehealth. So since COVID, that's become a very popular way to access healthcare. So I think a lot of people are familiar with that. So that's the second component. And then the third component is the essential savings package we built in. And this is 12 benefits that our members get discounts on. So that would be anything from dental to vision to alternative medicine, prescription drugs, hearing, lab testing, MRIs, counseling, and some travel discounts as well. So the essential savings would be the third component. So the essential savings and virtual primary care, those two components are designed to help with the small to medium items. And the medical cost sharing would be there to help with the medium to catastrophic items. So that is how Healthy Nomad has been set up in a nutshell.
That's really neat. It differs from insurance in that the bills are actually shared by members of the organization, right?
Yes and no. With Healthy Nomads, our medical cost sharing partner is Zion Health Share. Zion Health Share it's not a ministry. It's a nonprofit. So it does differentiate from the traditional healthcare sharing ministries in that way, but it also does not do it like a lot of healthcare sharing ministries structure where the members have to submit payments to pay for medical bills for other members. This doesn't work that way. All of the membership funds are kept in a trust. And if a member has a medical need, they simply submit the need request to Zion Health Share, And Zion Health Share will pull from that trust fund and pay your provider or you directly, depending on how you've set that up. So there's no member to member direct involvement. Zion Health Share oversees that.
Okay. I'm familiar with that kind of concept. That's something that's very similar to what I use.
You'll hear different language used with medical cost sharing plans like Healthy Nomads as opposed to insurance, because we have to differentiate from an insurance product for legal reasons. It's not a regulated insurance product, so we can't use words like deductible and co-insurance or even copay. So initial unshareable amount is the portion that the member has to pay before the sharing community can pay. To answer your question, it is a per medical need, per medical event. So let me give you a scenario. You mentioned an arm. Let's say you get in an accident, you break your arm, you have an ambulance, you have our visit, you have surgery, you have follow-up surgeries and rehab, and this goes on for months. All of the bills accumulated for that incident would be one medical need. So you don't have to pay the IUA one time in that situation. Okay.
Okay. And then next time I have a stroke later in the year, then what?
If you have a unrelated medical need, you would have to pay the IU a second and possibly third time. So with our plan, it's a maximum of 3 IUAs per household in a 12-month period. So if you have 3 unrelated medical needs in a household, then you could potentially be responsible for your IUA 3 times at a maximum of 3 times.
Okay, that makes sense.
Okay.
So if you've got an entire household, dad has a problem one time, mom has a problem another time, and one of the kids has a problem. That's 3. You pay for those, but then the 4th person has a problem and they don't have to pay that IUA again.
Or just the dad has 3 events, then nobody else has to meet their IUA. So it's going to be 3 per household no matter what. It's how a lot of the Obamacare marketplace plans work. You have an individual deductible, but there is a out-of-pocket maximum for those plans, which is generally 2 to 3 times the individual deductible. So it's people are probably used to that type of a structure.
Okay. And now you folks have different types of they range in $1,000, $2,500, and $5,000 levels. Explain
that is
that
correct.
bit.
Yeah. Yes. You can choose whether you want the $1,000, $2,500, or $5,000 IUA. All that means is if you go with the $1,000 IUA, you have to pay the first $1,000 of a medical need. And 100% above that is shareable. And if you're with the $1,000 IUA, then multiply that times $3,000. That is your maximum IUA risk for your household for a 12-month period. Same with the $2,500 and $5,000.
Okay, very good. And then everything.
I don't want to make it more complicated than that.
And everything above that is then covered through the plan.
Yes. Yeah. Everything above that, again, I have to shy away from using words like covered because those are insurance terms. But yes, anything above the IUA would be shareable if it's an eligible medical need, of course.
All right. Now, so how does this differ from insurance?
Yeah, the language, of course, it can be a bit confusing to people, but if you understand why we have to use that language, then it makes sense. So the structure of these plans is very similar, but if you understand the terminology, then it's not so complicated. But the way it's different, of course, is in the fact that you're not working with an insurance company. Our medical cost sharing, like I said, is through Zion Health Share, which is a nonprofit. So they're not regulated by the insurance commissioners of your individual states. They're headquartered in St. George, Utah. Anybody can enroll from any state, and it doesn't matter where you live or where you travel, you can use it. As a matter of fact, you can use the medical cost sharing component of your Healthy Nomads membership worldwide. So if you travel globally, as long as you're a U.S. citizen, you can still submit your medical needs from overseas.
That means that members are not confined to a specific network. So you don't have to hear
There is no network.
that
Right.
you have to find a doctor within our network in order to get service. You just go to any doctor. And many times it's cheaper because you can negotiate a cash pay discount with those providers and then submit the bill to a service like yours. Is that correct?
Yes, that is absolutely right. Zion HealthShare, they used to work with what's called the multi-plan network. And, they were finding that the discounts just weren't worth restricting people to a network. So they eliminated that network altogether. So there is no network whatsoever. You should present yourself as a self-pay patient. And yes, you generally get pretty decent discounts with providers presenting as a self-pay patient. But another way that Healthy Nomads and Zion HealthShare will help reduce those bills is through the medical advocacy program. If you have a medical need that you know is coming up, you can submit a simple medical advocacy form. Zion HealthShare will reach out to the providers directly and negotiate the prices down for you.
Oh, that's very convenient.
Yes.
For those of us who hate negotiation, that would work out really well.
Yeah, exactly. Okay. Obviously, that's difficult to do for an emergency situation, but if would be for a planned medical need.
Right. So you've mentioned Zion Healthcare in the past. Who are those folks and how did you come in contact or get to connect with them?
Yeah, I'd say about 7 years I was looking for a good medical cost sharing plan that was not attached to a healthcare sharing ministry, just because of the restrictions that a lot of the ministry programs have. I wanted something that was one of the pushbacks I got from people when I was off a medical cost or a healthcare sharing ministry many years ago, is I don't really like the religious requirements. And I get that. So I was looking for one that didn't have that. And I did find two of them. One is Sedera and the other one is Zion HealthShare. So I joined myself, Zion HealthShare, as a member 4 years ago, and I liked it a lot. And so I got to think, okay, let's bring this to the nomadic community. That's how I got started with Zion HealthShare as a member myself first. Wanted something that was more secular based and didn't have the religious requirements that the healthcare sharing ministry programs often do. But like I said, they're a nonprofit medical cost sharing company that has about 40,000 members. So Healthy Nomads, we're only a few months old, but you're backed by a Zion HealthShare, which has over 40,000 members. So there's plenty of membership funds coming in to take care of significant medical needs for the community.
That's great. It's nice to be able to partner with a program like that is big enough and recognizable within the medical community. It's got to help you folks. Now, is there an enrollment fee to join this group?
Healthy Nomads, we don't have an enrollment fee, but when you join, Zion HealthShare does have a one-time $50 enrollment fee.
And that's for all new members. So each member of a family would have to pay that, or is it per family unit?
Yeah, just per membership, per household. So one per family.
Okay.
Yeah.
And then I understand that you have an added fee for people who use tobaccos because they tend to have more health problems.
Yeah, there's potentially more health risk, which can lead to more medical needs in the future. So Zion HealthShare, that's a Zion HealthShare built-in additional $50 a month if a member of the household is a tobacco user.
For people who are old enough to remember the way it used to be back in the 1960s and 50s, when you would go to the doctor and you would pay the doctor, and you would go you had something and you had to go in to see somebody for a routine illness or whatever the case might be, you incurred that cost. And insurance back then was for catastrophic events, so that you weren't caught off guard with these big medical expenses. And that's what your program is returning to. The members are responsible for the little things, and it is here as the safety net to prevent you from being devastated by an unexpected or even an expected, in the case like you had talked about earlier, a planned medical procedure that could be very pricey and be well beyond the ability for most people to afford.
Yeah, that's a good observation, Greg. I wasn't around the 50s and 60s, but yes, I do understand that's how it worked. And we have, in the past 30 years particularly, gotten away from understanding what a healthcare plan really is designed for. And it's just as you say, it traditionally is designed to help in a catastrophic situation. I like to use the analogy of a vehicle, so that if you have car insurance to pay for a car accident that damages your car or totals your vehicle, you do not have car insurance to pay for your oil changes. You generally pay for your oil changes out of pocket. And health insurance, really, like you said, it used to be the same way. It's there to pay for the significant loss, and the member is generally responsible to pay for the smaller items. But I also would add that while that's true with Healthy Nomads, we did build in this virtual primary care and essential savings to even help with those smaller to medium items. So I think we've got the best of both worlds with the Healthy Nomads program.
And go on and talk about those virtual primary care benefits again, if you don't mind. You have
Sure.
a bunch of them listed on your website, but if you could talk about what each individual one would be, I think the listeners would appreciate it.
There's two separate things. There's the virtual primary care and the essential savings. The virtual primary care is through a partnership with HealthTap. HealthTap has their own on-staff U.S. board certified physicians that we work with. So when you join, you would go to HealthTap, select a primary care physician. That primary care physician would get to know you. You can share your medical records with them if you choose to. Obviously, that's to your advantage to do that. And you can work with that doctor as closely as you want to manage any chronic conditions and take care of routine preventive care as well.
Let me interrupt for just a second.
Yeah.
It sounds like you are assigned to a doctor so that you are constantly talking to that same doctor. Is that right?
Yes, it's not just a telehealth
Wow.
on-call doctor. This is your personal doctor. Yep.
That's a big
And
difference from other plans that I've talked to, because basically
Yes.
whoever answers the phone is who you get to talk to. But it sounds like this is somebody who gets to know you personally and your family and has a little better grasp of your history. What a benefit
Absolutely.
that is. Yes.
Yes. So that doctor can help manage conditions. That doctor can help with very specific needs like women's health, children's health, men's health, senior health, wellness and prevention, sexual health, mental, behavioral health. But also another component of the virtual primary care is the on-call virtual call urgent care. So with your primary care doctor, just like any primary care physician, you generally can't get a same day appointment. It's usually a day or two out. But if you have a medical need that's more urgent, like you have a child who's got a severe ear infection, or somebody has a urinary tract infection or something, and you need to talk to a doctor sooner than later, you can use that feature of the virtual primary care benefit, and you can talk to a doctor within minutes. That doctor can order prescriptions to your nearest pharmacy, wherever you happen to be, and you can get that addressed much sooner. But so yeah, there's two components to the virtual primary care. There's the personal doctor that you would have, and then the on-call urgent care if you need it as well.
Okay. And then all
Okay.
of the other essential savings then are bundled together, and that's in a separate package.
Yes. So yeah, again, the Healthy Nomads is medical cost sharing plus the virtual primary care plus essential savings. And the essential savings is a package of 12 benefits: dental, vision, alternative medicine, prescription drugs, hearing, lab testing, MRIs and scans, new benefits deals, new benefits travel, and doctors online and counseling services. So those 12 items are in the essential savings package. If you want, I can give you a brief overview of those.
If you don't mind, just
Yeah, sure.
because people might not understand what new benefit travel or new benefit deals means.
Yeah. So the dental is Aetna Dental Access, and you would save anywhere from 15 to 50%, depending on what you have done at the dental office. But it'll give you discounts for cleanings, x-rays, crowns, canals, and fillings, and even orthodontics. The vision, your savings are going to be anywhere from 10 to 60%, depending on what you're having done, whether it's glasses, surgery, exams, contact lenses, or what. Alternative medicine, this will give you up to 30% discounts for hypnotherapy, nutritional counseling, acupuncture, massage therapy, biofeedback, reflexology, yoga, Pilates, that kind of thing. The prescription benefit is 10 to 85% discount on prescriptions at 60,000 pharmacies around the country. Again, it works with all the major retail pharmacies, but you'll hear in a lot of these benefits a wide range of like 10 to 85%. It just depends on what pharmacy you're using and what prescription you're getting filled. So it's hard to predict the discounts until we know what we're dealing with. But the hearing benefit will give you discounts on whether it's hearing aids or hearing tests. The lab testing it works with all major clinical laboratories, 1,500 of them around the country, and typical savings are 10 to 80% for lab work. So this is something that if you're working with your primary care physician and your primary doctor wants to do an annual lab screening for cholesterol, liver function, thyroid, then the doctor can order that from lab you're near, and you can go and enjoy the savings for that as well. Same with the MRI and scans benefit, 40 to 75% on MRIs and scans. The new benefits deals, this is something that's also built in. It's really more of a consumer discount where you can get savings at over 500 merchants for things like health and wellness products, or even memberships, food and beverage delivery, electronics and apparel. So that one's a pretty broad spectrum of merchants that you can get discounts with. The new benefits travel benefit, up to 60% off hotel, public pricing. There's over 900,000 hotels you can get discounts with on that, as well as 200 airlines you can get discounts with, and places like Disneyland, Universal Studios, and SeaWorld, you can also get discounts on that as well. And then counseling service. This one I added because there's a lot of people who are looking for counseling and therapy services. And so I built this one in, and I particularly like this one because there's no limits on usage. So you could have 24/7 access to a licensed therapist who has at least a master's degree and 5 years of experience. So if somebody needs to talk to a counselor to discuss anything from depression, anxiety, or stress, struggles with family, work, or substance abuse, dealing with a loss, grief, or anything like that, then you can talk to a licensed therapist. And then the last one would be the doctor's online benefit. This is, again, a 24/7 access to just ask questions to a doctor, a pharmacist, a psychologist, dentist, dietitian. You can do this through email or through the smartphone app. Just ask a question and get a response within a few hours if you're just looking for some advice.
Those are pretty impressive add-on benefits to this program. So I think what we need to do is talk about cost if we could, because one of the biggest stumbling blocks to people hitting the road as full-time RVers is insurance. I need to have my insurance, or what am I going to do if I don't have access to that? And this program is designed to replace that and take away that worry. And after outlining all of those benefits, I am sure people are thinking that this is going to be an astronomical amount of money per month in order to access this. And apparently that is not the case, because I entered in some information for myself and I see the pricing here. Would you like to talk about that, or can I talk about that?
Yeah, if you want to, go ahead.
Okay.
Yeah, people are generally surprised. I get asked quite often, what's the catch? Why is it so low? The best way to answer that is it's a non-insurance product. It bypasses all the bureaucratic red tape involved with insurance. It doesn't have all of the ACA requirements built into it that have caused those rates to go through the roof over the past 7 years. And you're working with Zion HealthShare as a nonprofit, and there's no board of directors dictating profits and all of that. There's a lot of factors that go into the rates being as low as they are, but yeah, it's significantly lower than what people are used to with traditional healthcare.
That's right. I looked up the pricing for people it comes in different ranges, ages 18 to 29, 30 to 49, and 50 to 64. And so which one do we think work campers are going to be? Pretty much 50 to 64 or 30?
Yeah, I think that's pretty accurate. Most of them are right around the 50 to 55 age group.
Okay. So
in
these
my
are
experience. I mean, you've got others and who are obviously younger, but yeah, I do get a lot of requests from people in that 50 to 55 age group.
This is the highest priced plan that people have then. Once you reach that magic age of 50, this is what the cost is going to be. And for the $1,000 initial unshareable amount, which you would have to pay up to 3 times per year, depending upon the medical situations that you would have, the cost for one member appears to be $289. And that's for me who lives in Arizona. But if you add a spouse, it jumps to $519. And if you're adding children, it's $519. And for the entire family, it's $719 per month. And that's the maximum cost that you would pay for this, plus $50 a month if you're a tobacco user. So
that is correct. Yeah.
So if you wanted to more than double that initial unshareable amount, that price drops from $289 per member to $239 per member. So you increase that initial unshareable amount from $1,000 to $2,500, and the price per month drops by $50. And if you increase that initial unshareable amount to $5,000, then the price drops all the way down to $164 for a member, or a maximum of $494 for a family, which just seems like a real bargain to me, Kyle.
Yeah, especially in that 50 to 64 age group. If a family of 4 wanted to get a Blue Cross Blue Shield plan in Texas, which would be an HMO plan that's virtually useless outside of Texas, they'd be paying closer to $2,000 a month for a family of 4, or for a plan with at least a $5,000 deductible.
That's right.
If not higher. But yeah, cost savings there are obvious and significant.
I remember looking at Obamacare when it first came out, because I didn't have insurance at that point, and it was $13,000 a year is what my out-of-pocket expense was going to be before any insurance benefits kicked in. And so this is significantly more affordable than something like that.
Yeah, I have it for my family of 3. I pay $515 a month, and that's the $2,500 IUA. If I were to go on an Obamacare plan, my rate, at least I didn't look this year, but last year, was going to be $1,800 a month for a $7,000 deductible HMO plan. I'm never in Texas, so I really couldn't use it.
So who can join? Is this open to anybody?
Any U.S. citizen can join. Yes. So there's no requirements there's no religious requirements, of course. There are no pre-existing medical requirements, which is big. They take anybody with pre-existing medical. However, it should be noted that if you do join and do have a pre-existing medical condition, there will be limits on the sharing of medical bills associated with that pre-existing medical condition. So you'll have to wait at least 12 months before they'll consider a claim on a pre-existing medical condition, but anybody can join with or without a pre-existing medical condition as long as you're a U.S. citizen.
Okay, so if my pre-existing medical condition is high blood pressure or heart disease kind of thing, it will not allow me to submit a claim for the first 12 months. But if I break my leg in an accident, it would be covered.
Yeah.
Or whatever. It would be shareable, not covered.
Yes, thank you. Yeah, it's interesting you brought up high blood pressure, because high blood pressure, cholesterol, and diabetes actually are not considered pre-existing medical conditions. So those would be shareable from day one.
Oh my goodness. Another benefit.
Because they're so common that, especially in that 50 and up age group, that Zion HealthShare decided to not consider those pre-existing medical conditions.
Okay. So why would people want to join, or should they consider Healthy Nomads?
The people that would want to consider this option are obviously people who want something that maximizes their healthcare freedom. If you want a plan that is going to allow you to pursue your own healthcare path, because Zion HealthShare will even consider medical needs that you work with a functional doctor. So alternative medicine is not shunned upon with this program either. But so people who want maximum healthcare freedom and lower cost and have benefits that they can actually use no matter where they are traveling, whether that's within the contiguous 50 states or even overseas. Now, overseas, you won't be able to use your virtual primary care benefit because you generally can't do a consultation from another country with a U.S. board certified doctor. But the primary benefit of the medical cost sharing with this membership, you can use. So if you have a medical need that you have, let's say you're in Europe, you can come back to the States and have that get reimbursed for any medical bills that you had overseas.
Wonderful. Now, I understand that you folks are offering a free consultation for people who would still like to know, how do I really benefit from this? Or is this too good to be true? You're offering that free consultation.
Yes. Yeah, you can go on healthynomads.org, just go under the contact tab and click on contact us, and you can either submit an inquiry or click on the link to schedule a free call. And that would be with me. I would be open with people and explore it with them. And there's no sales pressure at all from this end. And we'll just explore it together. And if it makes sense, I'll tell you. And if it doesn't, I'll tell you that too. There are people who I've told that it wouldn't make sense for. And those that would not make sense for are people who are currently undergoing significant treatment for something. You're going to be much better off with, of course, it'd be more expensive, but a healthcare marketplace plan that will cover pre-existing medical conditions from day one. That would make more sense in that scenario.
So this website at healthynomads.org has a wealth of information that talks about the membership, what medical cost sharing is, and how the virtual primary care works and the essential savings, and has a long list of FAQs that answer just about every kind of question people are going to have about the program. And so I encourage people to go there to check it out, and then also just enter some basic information like your name, where you are, and your email address, and you can get access to the pricing and determine if it's a good deal for you.
Yeah, one note on the pricing request. If you go on there and you want to see the pricing, I've had people go on there and fill out the pricing request multiple times for multiple states. You don't need to do that. The pricing is the same for all states. If you go on there and you pull up the pricing page, it doesn't matter whether that's Texas or Florida or New York. It's all the same pricing.
Even California?
Yes, even California.
Wow. This has been fascinating, Kyle. It's a great program. It sounds desperately needed here for full-time RVers. And so I would encourage people to go to healthynomads.org and learn more about it, and then reach out to you if they have any questions.
Yeah, fantastic. I'd be happy to help chat with anybody and explore it with them.
I was blown away by everything that is included in the Healthy Nomads membership, and I'm grateful to its founder, Kyle Henson, for describing the plan and its costs in greater detail. I have used a faith-based medical bill sharing service for almost 10 years. It works very similar to Kyle's program, except there is not a religious component to Healthy Nomads. Kyle developed the program in cooperation with Zion Health Share, which is not a ministry like the program I use. It is a nonprofit organization, which means it does not have to generate super high profits to give back to investors and shareholders. Although it is not health insurance, it works very similar to automobile insurance, where people pay a monthly fee. But they only tap into the benefits when they have a major problem, such as an accident, fire, or a tree falls on the vehicle. People do not submit costs for routine service, like oil changes and new tires, to their auto insurance company. However, that type of plan is a lifesaver if there's a major problem that severely damages or completely destroys a car. Auto insurance offers various deductible amounts that policyholders must pay themselves, even after a major accident. Healthy Nomads works the same way. Because it is not insurance, the Healthy Nomads plan has various initial unshareable amounts ranging from $1,000 to $2,500 to $5,000, which members will pay themselves before submitting a bill for sharing to the Zion Health Share Trust account. The real benefit of a medical health sharing plan is the monthly cost to members. The highest Healthy Nomads membership cost to someone over 50, regardless of where they live, with a $1,000 initial unshareable amount is $289 per month for a single person, $519 per month for a member and a spouse or member and children, or $719 for a member, spouse, and all the children. The costs are even lower for younger people and if you opt for a larger initial unshareable amount. There is a one-time enrollment fee and smokers do pay an extra $50 per month for membership. But compared to most insurance plans and even Obamacare, it is a true bargain. Don't forget the basic plan also includes virtual visits with a regular doctor, virtual access to urgent care services, and a plethora of discounts on medical services and testing. Kyle is more than happy to discuss the program and options with any Workamper. For more information, visit www.healthynomads.org. There's a contact page on that site for people to schedule an appointment to speak with Kyle. Let Kyle show you how Healthy Nomads can help save money and eliminate stress. Reach out to him today. He'll give you more peace of mind about healthcare options. Today's episode is sponsored by Workamper News. With its Diamond and Platinum membership tools, Workamper News is much more than just a job listing website. When you put the tools of this professional service into action, you'll find out just how easy it can be to turn your work camping dreams into reality. The one-year memberships open the door to a one-stop shop for all things work camping. Being the original resource for work camping, you'll find the largest number of job listings, be able to connect with the community of work campers, and view resources compiled by experts who've been enjoying the RV lifestyle for many years. If you're serious about leading a successful and enjoyable work camping lifestyle, then a Diamond or Platinum membership is for you. You can even get started with a free 30-day trial by visiting www.workamper.com/trial. Embark on new adventures today with the support of Workamper News behind you. That's all for this week's show. Next time I'll be speaking with several people involved in the Blue Water Development, a company with a network of campgrounds that is looking for work campers. I'll have details on the next episode of The Workamper Show. Thanks for listening.